And we are wrapping up National Minority Health Month, and while this year's theme focuses on the continued importance of COVID-19 and vaccination, there are other health factors out there African Americans are at high risk for.
Insulin pens is a very convenient way.
The prescription for wellness, a renewed focus on what's undertreated.
Diabetes is the most expensive chronic disease that our healthcare economy has to deal with.
According to the American Diabetes Association, African Americans face greater discrimination and worse health outcomes. That's why health equity is Dr. Sinead Davis's biggest push.
There are also risk factors that we can do something about: our blood pressure, our weight, our nutrition, our activity levels.
Dr. Davis is just like her patients because she has diabetes.
It's not always, your lifestyle. I've never had a weight problem. I eat healthy, and I have, chosen healthy, diets and had food choices that were healthy all of my life, but it's my family history.
That's just one illness among many that are disproportionately impacting African Americans. According to the CDC, African Americans 18 to 49 are twice as likely to die from heart disease than whites.
When people get cancer, they get scared.
Dr. Brandon Blue treats folks at Moffitt Cancer Center. Part of his challenge to ensure wellness, he says, is offering health instructions that are understood by everyone. He picked up on this before entering medical school. Cultural competence is key, is what you're saying here.
We've been able to do what we call code switch for a long time. It was something that I knew. I grew up in my community and I knew the culture, because that's where I grew up in. Those are my people. And I knew that how we talked at home wasn't how I talked at school. It wasn't how,
That was not in the chapters of the medical book.
Exactly.
He's involved in a program at Moffitt called Train the Trainer, something that translates confusion for fellow doctors and patients.
So I have no choice but to succeed in that.
Is it exhausting?
The focus on mental health right now is more of a need than a luxury.
Jewel Woods runs Male Behavioral Health. He told me discussions about mental wellness is improving.
But having access to a therapist who identifies and is able to respond to the particular community or historical context for some of the issues that patients are facing is oftentimes important.
The doctor there, laughing at the question about exhaustion. You got to listen to the entire conversation on my podcast, A Frank Conversation, 10tampabay.com/Frank.